It's all about the Getting to Zero campaign. We've talked about this before, and if you're not aware of it, we want to bring it to your attention because it is so important. Here with me today, Kelsey Genovese. She is a physician's assistant with the University of Utah. Hi, Kelsey.
Hi, it's good to see you.
Hi, good to have you on again. Now, let's talk first things first. What is the Getting to Zero campaign?
So the Getting to Zero campaign is being put on by the Utah Department of Health. It's a 5-year project with the ultimate goal that we get to zero new HIV diagnoses in the state of Utah.
Okay, so let's talk HIV. How common is it in Utah and the United States?
So in Utah, we have approximately 120 new cases a year, which is one person every 3 days is diagnosed with HIV. So while we're low compared to some other states, it's been consistent for the last 10 years. So we really feel like with everything that's out there now, all the information, all the treatments that we have, we can get to zero in this state if we just work on it for the next years as a community.
Part of that is making sure that everyone's aware. And this last month, you really focused on the women and how common it is in women. So let's talk about that.
Yes, so on March 10th, that is the National HIV/AIDS Awareness Day for Women and Girls. So in the United States, 1 in 4 individuals that live with HIV are women, and 1 in 9 of those are completely unaware of their HIV status. So we really want to focus on encouraging women and girls to getting their HIV screening done if they've never had one before, but also encouraging medical providers to talk to their patients about this. It's a sensitive topic, so sometimes it's hard as a patient to bring that up. So it's important that we ask people and discuss their HIV risk because some folks don't even know that they're at risk.
Well, and I think that's my next question. So how do you know if you're at risk and who should be getting screened?
So the CDC actually recommends that everyone gets screened once in their life between the ages of 13 and 64. So if you don't know, it's a great question to just ask your medical provider, have I ever been screened before? And then other risks include sexual contact, not using condoms, IV drug use. There's a few other ways that you can be exposed. So it's a good conversation to have so you know what your status is.
Yeah, absolutely. And I think it's one that, isn't talked about as frequently, but you guys are really trying to raise awareness. And we've been talking about it with you now for the last several months as well. Right. But if people have a lot of other questions, you guys have a great website for them to go to.
We do. So the HIVandme.com is the health department website. It has resources, places you can get prevention, treatment, discussions about stigma. There's a ton of information there. It's a beautiful website to check out.
Great. Well, Kelsey, thank you as always for all the great information.
Yeah, thank you so much.